bio.
Hello, everyone, and welcome. Thank you so much for tuning in to our wellness seminar. And this event is brought to you by collaboration between Rapha Health Ministries and Ignite at JesusHouseDC. This topic or conversation today is centered around COVID-19 and dispelling the myths. As you know, this pandemic has hit us, and it is such an unprecedented event in our lifetime. And so this is such a timely discussion. All of us know someone who's been impacted by COVID-19. You know, we know people who have had the infection and have survived. You may even have had the infection and has survived. We also, unfortunately, know a lot of people who have passed away because of this disease and this virus. You know, in the US alone, we have over 30 million cases and over 500,000 people who have lost their lives due to this virus. That's 500,000 people who have lost their lives. So out of respect, if you please just oblige us, we would like to have a moment of silence for the people who have lost their lives due to this virus. May their souls rest in peace. As I mentioned, this is supposed to be an interactive discussion. We have a panel of experts who will be giving you evidence-based information. You know, with COVID, unfortunately, there's just been a lot of misinformation, a lot of WhatsApp messages that have been sent about all kinds of things. You know, does apple cider vinegar really cure COVID? I don't know. We'll find out from our panel of experts. We're going to cover a variety of topics today relating to COVID-19. We're going to talk about the virus itself, variants, vaccines, the infection, what to expect if you have the virus, what are the long-term symptoms of COVID, what are mitigation strategies that are there, and what is the importance of early testing. We're also going to be giving you a resource document. The information about this virus and the disease is constantly evolving. There's so much we know, but there's still so much we don't know about this. So information is constantly coming to us, and we'll do our best, not just to answer the questions, but also to provide you with the resource document at the end of all of this. So stay tuned. We have a packed agenda, so without further ado, I'm going to hand it over to my wonderful co-host to do the introductions.
Thank you so much, Dr. Fumi. Hello, everyone. Good morning, and welcome again to the COVID-19 Dispelling the Myths Wellness Seminar. My name is Timi Tokwe Ulumoko. I am a board-certified physician assistant and also a project manager. I currently work in the field of family medicine, but I have experience in urgent care and all the specialties. I will go ahead and introduce my first my co-moderator and then the panelists. So my co-moderator, Dr. Fumi Agumbiade, is a clinical pharmacist. She obtained her Bachelor of Science degree in biochemistry and molecular biology from the University of Maryland, Baltimore County in 2005. She was a research and development associate for 3 years in the biotech industry before pursuing her career as a pharmacist. She graduated from University of Maryland School of Pharmacy with a Doctor of Pharmacy degree and completed her postgrad year residency from Union Memorial Hospital. Currently, she is a project manager within the drug use management team in her organization. Dr. Ogechukwu Egini is a board-certified internist and a fellow at the Division of Hematology and Oncology at SUNY Downstate Medical Center, Brooklyn, New York. Dr. Ogini graduated from Nnamdi Azikiwe University College of Health Sciences in 2006. He was inpatient attendant on the Brooklyn VA COVID unit from April to June of year 2020. Next, we have Dr. Diana Sholano Chodende. She graduated from a doctorate degree in pharmacy from Howard University in 2007 and worked as a pharmacist at the Johns Hopkins Hospital, Baltimore, Maryland. She commissioned into the United States Public Health Service in 2008. Commander Sholano Chodende currently works at the Food and Drug Administration. And just a side note for Dr. Chodende, throughout the pandemic, she has been on multiple deployments to assist with the COVID-19 response. She's currently assisting the federal COVID-19 response mission handling outreach efforts for COVID-19 monoclonal antibodies for the treatment of mild to moderate symptoms of COVID-19. She's also a member of JesusHouseDC. Next on the panelist list is Dr. Onabajo. Dr. Olusegun Onabajo is a staff scientist at the Laboratory of Translational Genomics at the National Cancer Institute, a part of the National Institute of Health, NIH. His research includes functional studies to examine the role of genetic variation in the pathogenesis of hepatitis C virus infection and the development of liver cancer. He trained as a pharmacist at Obafemi Awolowo University in Ile-Ife, Nigeria, before proceeding to the University of Maryland, College Park. There he received a PhD in cell biology and molecular genetics in 2008, studying how we make antibodies to infections. He followed this up with a postdoctoral appointment at the Uniformed Services University for the Health Sciences in Bethesda, trying to understand how HIV disrupts our ability to make effective antibodies. He later joined the Laboratory of Translational Genomics at the National Cancer Institute as a research training fellow and was promoted to staff scientist in 2016. Since then, he's been focused on understanding genetic and environmental risk factors for liver cancer with a focus on underrepresented represented minorities. In 2020, he shifted his focus to studying COVID-19 and published an important finding about how our body might be defending us from the SARS-CoV-2 virus. He's also a member of JHDC. Next, we have Ms. Olubunmi Akindewo, who is an MSN RN. She's fondly called Bumi. She began her career in nursing in 2003 in emergency department in Washington, D.C. Over the years, she's worked in several departments in nursing to include critical care, psychiatric nursing, case management, leadership, and management. She has over 17 years experience in nursing. She graduated from Grand Canyon University in 2012 with a master's in nursing with focus on leadership in healthcare. Last year, when the COVID-19 pandemic hit, Mrs. Akindewo started her new career as a travel nurse. She has since worked in the hard-hit COVID-19 states to include New York, New Jersey, Texas, and Arizona, and mostly working in the intensive care units. Ms. Akindewo is a member of JHDC. Lastly is Mr. Motolani Agombiade. He is popularly known as the blind scientist. He is specialized and certified in pest control. Mr. Agombiade is a retention specialist for a pest control company. And relevant to this discussion, he's a COVID-19 survivor and he is willing to share his journey to recovery. So I thank you, panelists, for agreeing to speak on this issue. So I do have to make a disclaimer. The view of the panelists or the views of the panelists do not necessarily reflect the official policy or position of their respective agencies, organizations, employers, or companies. And the views, information, or opinions expressed during this seminar are solely those of the individuals involved and do not necessarily represent those of Jesus House DC and its employees. So, Fumi, I'll hand it over to you, Dr. Fumi.
Thank you so much, Tammy. So the next part of this event, we're going to have a wonderful presentation by Dr. Egini. He's going to talk to us all about COVID, as well as even touch on the vaccines and just give us information that we think is really relevant. So Dr. Egini, the floor is yours.
Morning, everybody. It's an honor to be with you this Saturday morning as we discuss these issues that are important at this time and try to make sense of how we go as far as preserving our health, protecting ourselves as we move forward and getting the best of what is available in terms of treatment and prevention of COVID. I'm going to start off putting up my slides. So welcome to you. And move forward. So I always like to start with Martin Luther King said it best, the time is always right to do what is right. And I think this is a timely meeting and hopefully helps us to allay some of the fears that we have, answer some of the questions. We may not all have the answers, but we promise to do all we can to help us get to a level of confidence as we try to encourage one another to move forward and do what is the right thing at this time to be able to take care of this scourge. The COVID-19 virus, many of us have heard about this. It's not anything new anymore. I think one of the brighter sides of this, beside all the mortality and morbidity that we have seen, is the fact that we have opened up discussion with even people who have no medical background as far as dealing with viruses and understanding how they work, so everybody can talk about it, So COVID-19 is actually the disease itself, which is actually, if you look at that split over there on your left-hand side of the screen, the CO represents corona, the VI is a virus, so it's a coronavirus disease that happened in 2019. So that's where the word was coined from. Actually, the virus actually is, the scientific name for the virus is what is called the SARS-CoV-2. So SARS-CoV-2 is the name of the virus, and the disease is called COVID-19. And this is just the basic structure. Don't worry about all of this, but it's just for some of us who may be interested, this kind of just gives us an idea of what the basic structure of this virus is like. The viral RNA, which is actually like the genetic material of the virus, and the nuclear capsid membrane of that virus. So one of the things I also wanted to mention, I want to put it out there real fast, is that safety is a cheap and effective insurance policy. I'm not sure who gave us this code, but it's something to remember as we run through some of the modalities we have for treatment, maybe even for one of the most important things is that we be safe as we deal with this situation. So how is this virus transmitted? The CDC is the Centers for Disease Control, and the CDC has defined at least about 3 ways by which people can actually spread this virus. We're going to take them one by one, and I have actually lumped them together with some of the ways that we can also protect ourselves from getting this virus. The first is close contact. And needless to say, that pictorial kind of tells us what this means. People who are, there is no barrier in between these two individuals. They are talking to one another. And unfortunately, the man on the left, is either infected or he's carrying the virus and is symptomatic. But one word, he's spreading the virus as he speaks to this other individual on the right. So close contact. And again, we know that we probably heard about this several times, that we can prevent this by wearing a mask. And further down the line, I would also say appropriate distancing. So the second method would be mode of transmission would be respiratory droplets that hang in the air. People sneeze, and it's not just for COVID-19. Basically, many of the aerosolized microorganisms that we have, tuberculosis, even the usual influenza, which is a droplet, people can actually get it as an air, people sneeze into the air, and those particles just hang around for a little bit. And so someone who does not have the virus can actually inhale it and get an infection from those droplets that are hanging in the air. Again, how do you prevent this? If you go back to the previous pictorial, wearing a mask helps, and of course, appropriate distancing. So it's been shown by multiple studies that at least 6 feet of distancing between two individuals, protects or prevents, reduces the risk of actually contaminating or coming in contact with this virus. I know there's a couple of studies that are coming out. I think there was one last week where 2 weeks ago, I believe, where some people are beginning to talk about 3 feet as an alternative. But now, as at this morning, CDC recommendation as far as distancing still remains 6 feet. And this pictorial kind of helps us to see much more aggressively what happens when people are less than 6 feet. They are unmasked and they are exposed to someone who has the COVID virus. You can imagine such tremendous particle impact that this individual is just basically inhaling. And if he's not protected, or if he's immunocompromised, or if he doesn't, for one reason or the other, he might come down with the virus. So the third thing is from touching surfaces. So you touch surfaces of people who have already gotten an infection, touched, and you put those hands in the mouth, in the nose, in the eyes. So those are risks for.
Dr. Agini, I'm so sorry. I don't mean to interrupt you. Do you mind? We just need a little bit more volume. I think we're getting notification that people are having difficulty hearing you. So maybe if you just bring the mic closer to your mouth,
Okay.
maybe that'll help. Thank you so much. Thank you.
I hope it's better now.
I believe so. Our technical person will let us know, but I believe it's better now.
Yes. Okay. So the third mode of transmission that's been described is contact with surfaces. These are surfaces of where people who have been infected or who have the virus may have touched. So those surfaces have those viral particles on them, and someone who is not infected or who does not have the virus touches those surfaces, rubs their face, rubs the nose, puts their fingers in the mouth, and then gets an infection. And for those who didn't hear what I said earlier, there are two things I mentioned. One, the first one is close contact as a mode of transmission. The second is airborne droplets. And we have just described the third one, which is touching the surfaces. And so all these pictorials, you see money, door handles, these are all places where potentially someone can actually get a virus, contact with a virus, and ultimately infect themselves. So the point is, do not touch your face, okay, and wash your hands. So those are the three methods: close contacts, respiratory droplets, and touching surfaces. Now, there are other things I had also wanted to point out about travel during COVID-19. Some of the things that we could do, of course, if you can, keep appropriate distancing, 6 feet again recommended. I understand that in certain cities, particularly like New York City, for example, when you are in the buses, it's not possible, it's almost impossible rather, for you to keep appropriate distancing, but at least wear a mask. If you can go on the bus with your hand sanitizer, on the subways with your hand sanitizers, do that, because that's actually something you can regularly use while you're out there to protect yourself. And wash your hands with soap and water whenever you can. Now, ultimately, what are we trying to do? We are trying to protect people from coming down with COVID pneumonia. That is where the COVID virus settles into the lungs and is able to induce a lung infection. Of course, you can have other kinds of infection that COVID virus can cause, but ultimately, what we have seen that is much other kinds of diseases and problems that can result from COVID disease, the virus. But ultimately, what has been more prevalent is a pulmonary infection. This is a chest infection and a pneumonia, and that is what has killed the most people. And that is what we want to prevent when we ask people to do all of these modalities. Wear a mask, social distance, and follow all of these suggested and recommendations by the CDC. Again, this might be a bit technical, but I just wanted to show some of the processes. I will not dwell on this a lot, but some of the processes that are involved with the ability of this virus to actually attach, get into a human system and be able to cause trouble. And then some of the receptors that are involved, the angiotensin converting enzyme receptor, and all that. We'll not dwell on this. So some of the symptoms that we see with people who have COVID-19 disease, and some of those very common ones include a fever, chills, we have myalgia. Myalgia is muscle pain. Some people have headaches and tiredness, fever, then cough, particularly cough, sore throat. Those are very common symptoms, particularly when you remember that many of the patients who come down with the COVID-19 disease actually come down with chest infections and pneumonia, as the case may be. Now, so again, now, has this increased visitations in the emergency room, people wanting to get tested because they have myalgias, muscle pain, they have a chill, they are scared, they think it is COVID, they show up, they want to go get tested. Yes. Is it a good thing to get tested and make sure that it is not? Yes. So, some of the people that we test and we find out that they actually have COVID-19, they may just have very COVID-19 virus. They may have very mild symptoms. May have a fever. They may have chills. They may have just some muscle pain, but they have COVID. Some of the options that we, there are two terminologies I wanted to describe and let us know, differentiate between both of them. One is quarantine and the other is isolation. Now, these two terms, I know since this whole COVID era started, people have used this so interchangeably that sometimes everyone thinks it is the same thing, but it is not. Quarantine is actually a word that refers to the separation of someone who has no infection, but is exposed to a COVID-19 patient. So you have a healthy patient, maybe a nurse, or, somebody at work in the office, and a staff member or a colleague, unfortunately, comes down with the COVID, with the disease, COVID-19 disease, that's COVID-19 virus, and you have been in the same office, so the employers may say, well, even though you do not have an infection, which means you do not have a fever, you do not have a cough, you don't have muscle pains, there is no infection, and there is no evidence of the virus, we want you to stay home for a period of time. So just to make sure that you don't come down with an infection. Now, the whole purpose of this is to make sure you don't come down ultimately with an infection with the virus and transmit it to other people. Quarantine, as opposed to isolation, is for someone who's a known case of COVID-19, and you are actually just keeping this individual away from people so that he does not or she does not infect other people. So two terms that I wanted to make a distinction about. Now, one more thing I also want to make a distinction about is the fact that, and I've heard this a couple of times, an infection is not necessary. An infection has to, someone who has an infection is an individual who has, well, in this case, COVID-19 infection is an individual who has the COVID-19 virus and also has clinical symptoms. So those clinical symptoms include such things as a fever, some of the things that I have already described on this previous slide. This is different from someone who has the virus hanging around and is simply, and does not have any infection. You may have something in the nerves, in the nostrils, that people, you swab it and you find it, asymptomatic, but that's not an infection. An infection is defined as the presence of the microorganism causing a clinical symptom. So some of the other things, like I already mentioned, that you could have, COVID-19 could affect is all of these systems. Those of us in hematology and oncology too have seen, you see tons of, we've had referrals of tons of blood clots, some patients who have had COVID. I've seen one or two patients who had, who came down ultimately with kidney injury that ultimately progressed to requiring dialysis because there were clots in the artery that supply the kidneys and all that kind of stuff. So the GI tract, which is the hole from the mouth all the way down to the rectum, all of that can be affected. The liver, the pancreas, the ability to excrete, memory, strokes, all of this can be affected by this infection. This is a busy slide that again tries to define how COVID-19 causes pneumonia in the body. This is busy. I will continue on. The other things I wanted to point out is that even though some of the disparities we have with COVID-19, we know that Black people, Hispanics, and Native Americans, pardon, that should be Native, that apostrophe should be there, about 4 times more likely to be hospitalized. This defines, we can turn this around in different flavors, but to define why is this happening, what happens, why is the impact, in terms of hospitalization and death, more of a minority problem. But the fact remains that is what the data shows, and it reflects on some of the disparities we have in the health system, and part of the reason why we're doing this, to remind all of us that we have opportunities and that we can take to begin to close the gap on some of these disparities. Again, we look at those fatality case rates and fatality rates, and it's interesting that you look at that look at Black and African Americans, the column on the right. So it's 166 per 100,000 deaths. So again, this is reflecting on all of that, on all of those disparities that we see in our healthcare system. Again, minorities are more than 3 times likely to die of COVID. So now that we've done all of this, Maya Angelou says, do the best you can until you know better. And now that we know better, let us do better. So that takes me to the next point, which is the road to your vaccine. And I'm going to run through this real quick because I know many of us will have questions. And we can address some of this when we do the interactive session. Again, I'm talking about the disparities. And again, this is a national survey. 55% of US Black adults worried about getting the infection, but only 49% interested in the vaccine. So in the United States, there are 3 vaccines right now that are approved. The Pfizer first, and the Moderna followed, and now we have the Johnson & Johnson. Many of these vaccines follow a, these are the different kinds of vaccines. The way the vaccines were made, the methods by which the vaccines were made. The Pfizer and the Moderna are both mRNA vaccines. They were the ones that came out first. The viral vectors, the only viral vector that we have now is Johnson & Johnson. AstraZeneca is not available in the United States, it's approved in Europe. But those are viral vector vaccines. Again, this is our approaches. I know we may talk about this during the interactive. If these issues come up, we can discuss some of the approaches to making a vaccine. Just to point out that the mRNA vaccine is actually a technology that's amazing. The technology of the mRNA that was incorporated into making both the Moderna and the Pfizer vaccines is an amazing technology. First time we're using it. Interesting, is something that scientists have been working on for the last couple of years. mRNA protein DNA transcription, all of that process, and to RNA translation, making protein synthesis is something that's not really new, but it's a technology that we are now seeing that we can adapt to making vaccines that are effective. And we are seeing that with the case of COVID, an effective vaccine that is able to help us fight this scourge. Again, it's just to point out again on the vaccines, subunit. Now, what does a vaccine, in general, how does a vaccine work? And this is not just limited to COVID-19 virus alone, but in general, what you do when you introduce either a foreign body that an individual's body recognizes as foreign, a protein, whether it's a virus, whether it is the protein comes in terms of, in the case of some of this COVID-19 virus made from an mRNA, the body recognizes those protein or parts of those protein as something that is foreign. And what the body does is that it creates antibodies. It makes antibodies from our cells, the cells in our body, B cells, that fight infection. It makes those antibodies, and those antibodies are able to recognize those proteins and attack those proteins whenever those proteins show up again, in summary, in the body. And so in this case, if this protein or part of this protein is found on COVID-19 virus, and it's a body that's already sensitized and those antibodies are already made, what happens is that those antibodies, when the individual actually comes in contact with COVID-19 virus, those antibodies recognize that protein or that portion of that protein and say, gee, this is new, this is foreign, and it attacks it. And in the process of attacking it, it destroys it. I'm trying to break it down as much as I can. So we have the Moderna, we have the Pfizer, it's injected. This is injected for, this is 2-dose injections. For Pfizer, it is on day 1 and on day 21. For the Moderna, it's on day 1 and at least on day 28, 4 weeks. The Johnson & Johnson is a single-dose injection. The AstraZeneca is approved by the WHO. It's available in Europe. I perceive that the issues around AstraZeneca are being resolved now, and that it will soon be available also in the United States. Again, these are the rates as at some of these interesting data as at March 24. 30 million cases reported, But this is a number that actually is very interesting. If you look at that lower down, change in 7-day average since the prior week. Remember, this was reported on March 24th, so 6.7%. So there's an uptick, and we need to continue what we're doing not to lose out. You can see that these are the vaccination trends, and I got vaccinated because I think the data on the vaccine is good and it is protective. And we can talk more about this during the information session. Again, these are some of the common side effects that people have reported. Get your vaccine. Thank you.
Thank you so much, Dr. Agini. We really appreciate you sharing what you have said is timely, which I agree, and information about the vaccines as well. We really appreciate you sharing your time and your knowledge with us, so thank you. And this brings us into our next segment, which is the Q&A segment. This is the first Q&A session. We're gonna have another one a little later during the event. Now, we have questions that were pre-submitted prior to the seminar, which we'll be taking first, but I want to encourage you to go ahead and type in any questions that you might have in the chat, and we'll do our very best to get to every question. We can't guarantee we'll get to every single question, but we'll try to group some of these questions into question types. So hopefully you are able to leave with something from it, even though we may not ask your specific question. So I'm gonna hand it over to my co-host, Tammy, to kick it away.
Thank you, Dr. Fumi. So, Dr. Agini, that was an excellent presentation. Thank you so much. We got a lot of information regarding the vaccine and about the COVID-19, the difference between quarantine and isolation. So thank you. So in your presentation, you mentioned the different types of COVID-19 vaccines and how they worked. Could you please elaborate, because I believe you mentioned that the mRNA vaccines were the Moderna and the Pfizer, and the viral vector vaccine was the J&J. Could you elaborate more on that?
Yes, absolutely. So can you hear me?
Yes, we can. Thank you.
Okay. Yes, so the Moderna and the Pfizer vaccines were made with the mRNA technology. The mRNA technology, basically what they did was that they took a part of what is called a spike protein. It's a part of the protein, you know, I showed us the covering of the virus. It's a part of the protein on that virus, unique to the virus. So what they did, what was done was basically that a portion of this protein on the virus was taken out, was used to make an mRNA. mRNA, ribonucleic acid, is what you get when you try, you know, it's, I'm not biology, I'm trying to break this down as simple as I can, but it's what you get, the first product you get when the DNA in a cell is trying to multiply itself. So it makes RNA, and then the RNA is made into a protein, which the body uses as building block to do what it needs to do. So what the smart thing that was done here was that an mRNA of this portion of the virus was made. So that mRNA is what is injected into people as a vaccine. So when the mRNA is injected into individuals, what happens is, I'm gonna go, I don't know if, all right. What happens is it doesn't go into the DNA, into the nucleus of the cell. So the cell has, you know, a cytoplasm and it has a nucleus in the middle. It doesn't go into the nucleus. It goes into the cytoplasm of the cell, where the cell mechanism translates this RNA into a protein. This protein is recognized by our bodies as something foreign. So our bodies say, gee, this is new. I've never seen this before. So what the body does is to try to clear out this protein. How does it clear it out? It forms antibodies to clear out the proteins. So those antibodies are made from our immune system, the B cells in the body. that we have. They recognize these foreign proteins, they make these antibodies against it. But then those antibodies hang around and watch. So if you come in contact with COVID-19 virus, what happens is that your body, the surveillance system of the body sees the virus, sees the protein that it previously recognized and says this same bad protein, foreign protein is bad. He attacks it. In the process of attacking it, it kills the virus as well.
Okay, so basically a part of the protein of the virus is injected as a vaccine into people.
No, it's not the protein of the virus that's injected. It's the RNA is let me put it this way. It is the substance that from which the protein is made from. So what the scientists did, which is very smart, is that they reverse engineered a part of the protein of the virus, and they were able to get this RNA. So it's the RNA that is injected, and then our body translates the RNA, because every RNA that gets into the body gets translated to a protein. And in this case, when it translates it to this protein, it is a protein. It's the same protein that is on the virus that it translates it to. But remember, it's just a protein that it translates it to, not the virus. So you're not going to get infection because of that protein. But that protein is foreign to us, because I don't want to take us too far back because into development and how the immune system develops, but it is foreign to us. Our immune system has never seen this protein before. So the immune system says, okay, it is new. I got to destroy it. It does not belong here.
Okay.
And so, yes, so that's what happens.
Okay, so thank you so much, Dr. Guinea, for that clarification. Dr. Fumi, go ahead with your questions.
Sure, thank you. Just a brief reminder to all of our panelists. Again, thank you so much for providing your expertise. Just wanted to very quickly remind you to please, because we have so many questions to get to, do your best to try to keep your responses succinct and to the point. With that, my next question is for Dr. Onabajo. Dr. Onabajo, you work with the NIH, and there are valid concerns with a lot of people who do not really understand the vaccine process and how it's developed. And a lot of people are very concerned about how quickly this was, quote unquote, rushed to the market compared to what a normal process would look like. So can you share your perspective on how these vaccines got authorized for use so quickly? And should people trust the process? I think that's the key question I'm trying to ask here.
Thank you very much, Dr. Agubiade, for that question. First of all, I'd like to thank the Rapha Health and JHDC for putting this together. And like Dr. Agini said, this is very timely. About the question you're asking, well, one of the first things I will say is technology has advanced significantly when it comes to the kind of techniques that we use to make vaccines. The DNA was sequenced for the first time in 2003, but it took about 13 years to make it. Now we can make DNA we can sequence the entire DNA from a human being in one day. So this kind of technological advancements have really ramped up our abilities to do amazing things in the area of molecular biology. So now, with respect to the making of the vaccine, one of the first steps you need is to know the sequence of the virus. And by January 19, the full sequence of the SARS-CoV-2 virus was published when it was first detected just about a month before then. So that was the first significant speed up of the process. Once we know the sequence, we know how to make a vaccine for it. The second step that was very important and critical to the rapid development of the vaccine was the fact that it was a pandemic that was infecting at its peak almost 1 million people per day all over the world. So they were able to get sufficient power to do statistical analysis of 2 different groups that were given the vaccine or no vaccine, how many people got sick in one group versus the other. So this also incredibly sped up the process of vaccine development. And the third was money. a lot of money was pumped into 10 candidate vaccines that were identified by the US government to start producing the vaccines even before the test results came out. So even if they were a failure, they will still have made the vaccine. That way, immediately EUA, Emergency Use Authorization, was provided, the vaccines were more or less available. So these were the kind of strategic decisions that were made that greatly sped up the process of vaccine development, taking it from what would have been maybe 3 to 4 years to roughly less than a year. So clearly it was kind of a tour de force where a lot of people, a lot of money, and a lot of resources came together to achieve this amazing feat of biology, of medicine. And there's absolutely nothing sinister about the process of this vaccine development. It was done with all necessary controls and safety standards being met. And don't forget, we are using this vaccine on what is called an emergency use authorization as well, which means it is used because of the emergency of the situation. So it's not undergoing post-marketing surveillance like some other vaccines will have undergone. Some of my pharmacists can speak more to that. So it's being used even though there is not a very large group of people that have already used it before it was authorized. I hope that answers the question, Dr. Gumbiade.
Yes, it does. And thank you so much. So it sounds like, because again, going back to how this is unprecedented in our lifetime, all of the resources were sort of put and poured into this so that we could really try to speed up, in a sense, the vaccines getting on the market. And I think you and Dr. Agini touched on something also, which is the technology was already there. We just leverage what was already there to then try to make sure that we create vaccines, but in a way that all of our resources are sort of poured into this. So thank you for shedding some light on that. Really appreciate it. Tami, over to you.
Thank you. Dr. Chodende, so this question is for you. So let's say someone has heard all this about vaccines and they have preferences. Do they have a choice? Can we choose the vaccine?
Well, you don't. Pretty much. In other words, as soon as you can get your vaccine, just get it. It doesn't matter which one you get. Moderna, the one from Pfizer, or even the new Johnson & Johnson one. Just get it. There's no choice. There's no choice. I mean, it depends on, where you're located, what state you're located, what county. But rather, the whole goal is just get your vaccine. Right now, we have close to 15% of the population in America that have been vaccinated. They've received full vaccines. And you want to be part of that because, you don't want to deal with the variants coming. Get your vaccines as soon as possible. Thank you.
So you've highlighted that although there are options out there, whichever is available for you, just get it so you do not get the effects of being infected by COVID. So thank you, Dr. Chodende.
Bumi, this question is for you. Actually, the question is twofold. The first question that I have for you is, there are some people wondering, I'll take my chances. I don't want to take the vaccine. I'll take my chances with the virus. What would you say to that? And then the second question is, if a person who decides, sure, I'll go ahead and get vaccinated, can they still be infected if they get vaccinated, and can they infect others if they get vaccinated?
All righty. So as all the other panelists have said, the doctors, we have data, and the data is that you shouldn't take your chances. You should get vaccinated as soon as possible. Since last year, we've been taking care of critically ill patients, and the mortality there, it's when by the time the patients come to the ICU, we have 1%, sometimes 0.5% of patients go home. What does that mean? 99.5% of patients that come to the ICU die. It's sad, but that is the data and that is the truth. So we need you to get vaccinated. As Dr. Chodende said, just get vaccinated as soon as you can. And the second question, we're still looking at data because we have some patients that when they got the vaccine, we've had patients that still test positive for COVID, but that is like 0.000%. The data still favors patients and people in general getting vaccinated. So my answer to that is that you are better off getting vaccinated. Please do not take your chance because you do not want to end up in the ICU with a tube helping you to breathe. So we are asking you to please do everything possible to get yourself vaccinated.
Thank you
Thank
so
you
much
so
for
much.
that.
Go ahead, Tammy.
Thank you so much for that insight, Nurse Bumi. So my next question to expand on that is for Dr. Agini. So let's say a patient of yours comes in, says that they were infected with COVID-19, but yet they got better, thankfully. Do they still need to get the vaccine?
Well, absolutely. They should, because they should get vaccinated. We encourage it. The reason we do is because we don't know. This is a horrible disease, and people like people who have people can get reinfected after they've had COVID. Okay, so you want to give everybody enough chance, enough protection. So short answer, should get vaccinated. Yeah.
Thank you, Dr. Agini. So everyone's heard it loud and clear. Get vaccinated. Don't take your chances with this disease. It is a horrible, horrible disease. We've seen people dying from this. As Nurse Bumi said, when people get to the ICU, it's almost too late at that point. So please don't take your chances. Get vaccinated. Dr. Anabajo, my next question is for you. A lot of people, of course, because of the pandemic, we've been locked in our homes for the past year. A lot of people are itching to just be out and about. And now there's this almost, there's this thought that now that the vaccines are out on the market, I can go and do whatever it is that I want. So the question is, if I'm vaccinated and my friends and family are all vaccinated, can we still hang out without masks? Do we still need to comply with social distancing? What's your take on that?
Thank you for that question. I will avoid giving you my take, but I'll give you CDC's take. And it's a very, very specific set of rules that have been put in place. And basically, it says that if you're fully vaccinated, you can gather indoors with fully vaccinated people without wearing a mask. So that's a CDC guideline. You can also gather indoors with unvaccinated people from one other household. For example, if you are visiting your relatives who live together without masks, you can do that, but you have to be vaccinated. If the household is more than one, then you cannot go in without a mask, okay? Another thing you can consider is when you are in public, you still have to wear masks, even if you are vaccinated and maintain 6 feet of distance. And you should still avoid medium or large size gatherings because the risk is, even though minimal, is still there. So that in a nutshell is what the CDC guidelines are recommending for fully vaccinated people. And I must add, what fully vaccinated means is that for the mRNA vaccines, after doses 1 and 2, you wait 2 weeks after your second dose. And for the Johnson & Johnson vaccine, after dose 1, you also wait 2 weeks after that dose. Thank you.
Thank you so much. So, everyone's heard it. The CDC does say that it is allowable within certain restrictions. So, that's something to be mindful of. However, ultimately, this is your life. So I would say, if you wanted to take an abundance of caution by still complying with some of these rules, there's absolutely nothing wrong with that. But we will follow what the experts are leading us to believe. And Dr. Onabajo touched on something. Fully vaccinated, waiting 2 weeks after you've gotten your second dose of the mRNA vaccine, and then the single dose of the Johnson & Johnson. And that's because it takes your body some time to build an immune response. So if I get the second dose of, say, the Mrna vaccine today, I am not considered fully vaccinated tomorrow. I have to wait at least 2 weeks before I can consider myself fully vaccinated. So I hope that's something that everyone hopefully provides clarity for everyone. So thank you, Dr. Onabajo, I appreciate that. Tammy?
Thank you. So Dr. Chodende, this question is for you. I know that you are familiar with the FDA, and we know that the COVID vaccines and treatments have been authorized for use by the FDA under the emergency use authorization or expanded access, haven't gained full approval. So could you clarify what the difference between the emergency use authorization and the FDA approval is?
Yeah, definitely. So, in terms of, in situations where, of course, like you just said it, public health emergencies where, you can have some kind of a bridge to the national security, it's the COVID-19 has spread like wildfire. So of course, there has to be something that's enabling some remedy to come into, the market to save lives. And so what would happen in that instance is you have, the vaccines, you have other therapeutics that have been authorized only for emergency use. Okay, so that's the emergency use authorization that goes with the vaccines and all. And then it's not to be construed that it's not approved, so it's not good. No. There's a difference, big difference. When you want to submit, a drug to get an approval, it has to go through a thorough, number of tests and studies before it can get approved. However, only because of the situation we have at hand, just to prevent more loss of death, this is why you have the vaccines that are being authorized at this time. And as far as the approval goes, that will happen over time. But the clinical trials still have to show that these drugs and all these remedies are safe and effective to human beings.
Okay, so thank you. So even though it has gone through emergency use authorization, it is still approved, but it was approved earlier because of the pandemic and the lives lost.
I will say it's authorized for use. Yes, authorized to save lives. Yeah.
Thank you for that.
You're welcome.
Thank you. This next question could either be for Dr. Onabajo. You could take the first shot at it, and then Dr. Chodende, if you'd like to chime in too, that would be great. So a lot of minority groups are they're skeptics, and rightfully so. You can understand it when you think about some of the history of how experimental drugs have been used in these minority populations. One that comes to mind right now is the Tuskegee Airmen, and so there's just there's an overabundance of caution when it comes to the vaccines, and this, it's leading to vaccine hesitancy in these groups. So, I know we just touched on the emergency use authorization, and I know it's based on preliminary data, but it kind of goes back to that question of why should they trust it? Knowing the history, right, in these groups, knowing all of this, why should these minority groups trust the process?
That's a very good question, and I do appreciate the hesitancy, especially considering the unfortunate history of medical ethics on minorities in this country, and actually all over the world, actually. But we refer more to what's going on in this country. Fortunately, one of the things that was done earlier on in this vaccine was that sufficient power was achieved with the minority populations that were tested for the vaccine. So there is data that supports the safety and the effectiveness of the vaccines in minority populations. So that's very important. Secondly, it's also important to point out that some key members of the team that developed the Mrna vaccine were actually minorities as well. Dr. Kizimeka Corbett was one of the people that developed the initial structure of the sequence that was put in for the Mrna vaccine. And, I cannot imagine a situation where she would not have considered safety for populations like hers. And finally, emerging data from people that are currently vaccinated is showing that the vaccine is having no unusual effects among minority populations compared to non-minority populations. It's doing its job, and the safety profile is very similar. So I can dissuade most people's concerns that there's nothing nefarious about this vaccine. I myself have been fully vaccinated. I'm still here. I'm standing. I haven't mutated yet. So I have full confidence in the efficacy as well as the safety of the vaccine based on what I have seen so far. Thank you.
Yeah, and I do want to add to that. Thank you very much, Dr. Nabaja. This is really dear to me because, as a public health service officer, we keep hearing about the Tuskegee study of untreated syphilis in the Negro male, so African-American males. And yes, it was, the study was done, to observe the natural history of untreated syphilis in African-Americans. And it's one of those times in our history that we can't take back. It happened, and what we're left with are the lessons, of the impact of what happened then. However, as a public health service officer, as a minority, a member of that specific population, it's getting over that stigma that there's something going on, there's something wrong with the vaccine. Trust me, you don't want to get the virus. You'd rather get the vaccine, and all we can do is move on. And look around. Don't look at yourself. Look around at everybody else. How many people have gotten the vaccines? Like I said earlier, 15%, close to 15%. That's 14.7% of the population has been fully vaccinated, meaning that they got their 2 vaccines, or one with Janssen. And if you look at reports of what side effects came about, who died, how many, it's minimal in comparison to how many people got vaccinated. I think it's almost 137 million people have been vaccinated, just with 1 or 2 shots. So it's important to always remember that mindset. When you are taking that vaccine, take it with a positive intent. It's there to protect you. It's there to build the immunity that you need to fight the COVID-19 virus. And again, it's so important right now as of today. We have a couple of variants coming out. And so rather than get locked up in the whole, is this safe? Is this not safe? Just look outside and see how many people have gotten it. I've gotten my shot, the 2 of them. And I'm just advocating for as many people to get it so that we stop getting stuck in that mindset that this is something that's going to be against us. Rather, it's for us. It's for our own good. Thank you.
No, thank you. You both bring up really, really great points. For people who are skeptics, and we understand the history. And as you said, Dr. Chodende, we can't change it. We can't run from it. We just have to learn from it. And I think there's been a lot of lessons that we've all gleaned from it. And, Dr. Nabaja, you mentioned that the vaccine and the studies were done, a lot of them were led by by someone who is considered a minority. And when you talked about having sufficient power to everyone, just to break that down a little bit more, when you're looking at the power of a study, you're sort of saying, okay, if I enroll these many people in the study, will I see what I'm trying to observe? Will I get the observations within the study and draw meaningful conclusions from the study? So to that end, a lot of these studies did include minority groups and enough of them to be able to draw meaningful conclusions from those patient populations. So we hope that all of those things, sort of alleviate and allay your concerns about minority groups getting these vaccines. So thank you both so much. Appreciate that. Tammy?
Thank you, Dr. Fumi. And one of the worries that some people might, voice is the side effects. So, Dr. Agini, what side effects could we expect from getting the virus? I'm sorry, from the vaccine, not the virus, from the vaccine. And if, let's say, your patient says, "Oh, I got the vaccine, Dr. Agini, but I didn't feel any side effects," does that mean the vaccine did not work? What would you say to them?
Okay, so yeah, thank you for that question. I think some of the commonest things are very. Some of the commonest side effects, probably listed a couple of them in my presentation, but they include such things as muscle pains called myalgia, fever. Some people have had fever, low-grade fever, nothing too much, chills here and there, maybe even sore throat, certain things, but these things just last a couple of days, and they go away. And actually, the CDC, for many people who got the vaccine, what the CDC has also done is you can track some of the side effects via a website. They send you, if you register on that website, you get a link every day. So you can track some of those side effects on that link, and be able to put on some of the information. And basically, I also had, after my first dose, I remember having an enlarged lymph node, cervical lymph node right here, that resolved that after a couple of days. And if some of you came across that article a couple of weeks ago, some women who took the COVID vaccine and they went to do mammogram, and then they started having features, mammogram, enlarged lymph nodes, and people started thinking, oh, do they have cancer? It's just reactive. After a couple of days, those things go away. It wasn't cancer. It's just that those lymph nodes were enlarged. From it happened to some individuals. So, but now coming to your second question about if you don't have significant side effects, does it mean the vaccine did not work? That's actually, no, that's not what it means. It doesn't. You don't track whether you induced an immune response from the vaccine by the symptoms, whether you had a fever or a chill or those type of things. Some people had nothing, and they are fully vaccinated, and they have an immune response, and they are protected. Thank you.
Thank you, Dr. Guinea. So what you're saying is that if someone had the vaccine, they may have the side effects that you mentioned, or they may have no side effects at all.
Absolutely,
but
yes.
It's still being effective. Okay,
Yes.
Thank you so much.
Thank you. This next question is twofold. Dr. Nabaja, this is also directed at you first, but Dr. Agini, please feel free to chime in. So we are in a situation where a lot of places we're beginning to see a decline in cases, which is great news for us. But now we're hearing about variants. We've heard about the UK variant, the South African variant, the New York variant, etc. So how do you think that this could set us back? And then the second part of this question is, can any of our current vaccines protect us from the variants?
Thank you very much. That's a very good question, and it's a complicated question. So I'll give you a brief 20-second spiel of viruses. So viruses copy their DNA, and they are very mistake prone. Some of the mistakes the viruses make them stronger, and some of the mistakes the viruses make them weaker for our immune system. So the more time the virus spends in our body, the more chances it's likely to make a mistake that will make it stronger and evade our immune system. Unfortunately for us, many of the vaccines were developed quite early in the initial sequence that was used was developed quite early in the infection, and a lot of mutation has taken place going forward. Some of the mutations have made the virus spread faster or made it more virulent. For example, the UK virus apparently is very fast at spreading compared to the previous version. The South African virus is a bit interesting. I don't want to go through much nuance, but it's a bit more problematic because it has acquired multiple mutations. What that is causing is some concern among professionals that the original vaccines that were developed might have weaker efficacy on the virus. It's important to point out that it does not mean that those vaccines are totally useless. It's just that they will not give as much bang for the buck as the initial data that they generated was presenting. But I believe, and based on all the anecdotal evidence, that these vaccines are still extremely important for this variant as well in reducing the likelihood of severe disease and death. This is especially important when you look at the data coming from J&J, which was a later trial that started a bit further down in the COVID infection process. You could see the efficacy numbers go down in places where the virus was circulating widely, the variants were circulating widely. For example, the J&J virus was looked at in South Africa, where the variant, a very naughty variant, was circulating. It was still efficacious, about 58%, but it was for getting infection, but it was actually very effective at preventing severe disease and death. That's the key word, and that's what we have to pay attention to. It's possible you will get a variant and still get a small infection that feels like a cold, but I can guarantee it's not likely to lead to the severe infections of hospitalization and death that we are very concerned about. So that's the nuance that we have to pay attention to. Thank you.
Thank you. Dr. Guinea, I'm not sure if you wanted to add anything to that. I think you're on mute, Dr. Guinea.
Yeah, I think it's well said. We encourage everyone to get the vaccines that we have now. Whatever protection you get from that is better than not having anything at all.
Thank you. So it sounds like there's still a lot that we're uncovering with the variants, but it's still important to get the vaccine because it can really prevent you from getting severe disease and death. And, you know, we want everyone who is here and alive to still remain here and alive. And so please don't be a skeptic. You're hearing all of these facts. Please get the vaccine. They could offer some protection against the variants. So thank you both. Tammy?
Thank you, Dr. Fumi. So I know there's several parents out there listening to this, and they have questions about vaccinating their children and about vaccines for children. So specifically, Dr. Guinea, I have a twofold question with an additional question after that for you. When will vaccines become available for children? And secondly, right now, since there are no vaccines available for children, how can we best protect them from contracting the virus?
I think, yeah, thank you for the question. First of all, I think we all have to keep doing what we've been doing. Encourage people to keep doing what we've been doing, which is wear a mask. For children that can wear a mask, the recommendation is people from 4 years, at least above 2 years. And social distance when we can. I mean, it's difficult with kids, but hey, you got to try what you can try. We don't have a vaccine, you know, right now approved for kids. I suspect that we will have one in the coming weeks because both Moderna and Pfizer are actually working on a clinical trial now for children 12 to 6, I believe 12 to 18 at this time. And they're actually hoping to start a trial. Oh no, actually I think Moderna already did start. Pfizer did start, sorry, this past week, Wednesday, a trial on children less than 12 years, and Moderna is hoping to do 6 months to 12 years trial. So in the coming weeks, we're going to get information, more data on children 12 to 18 years. Hopefully they can be included in these trials. But I think the greatest thing, I think one of the most important things is let's keep doing what we're doing, what we've always been doing, encourage children to wash their hands when they can, sanitize as much as you can, wear a mask, crowded places, physical distancing, those type of things, it's good for COVID, it's good for every other disease, amen.
Thank you for that, Dr. Guinea. A follow-up question, and I'm sure parents will be, it's probably on the back of their minds right now, is since there's no vaccine available for children just yet, when can we expect all schools to fully open?
I don't know if I have an answer to this question.
The rest of the panelists can chime in as well.
I'll be honest with you, I want schools to open like today, like yesterday, because I need to, but the truth is, I guess this is not a question. I don't know, maybe somebody here can answer this question. I don't know if we have the answer to this question because it's a lot of forces involved. You got the teachers involved who need to be protected. How do you protect the teachers? Are they all vaccinated? Those type of things, hospital staff, school staff. How do you get this? Kids are going to come back home, deal with the parents, are there immunocompromised people at home? I'm not saying we should open schools. I want schools to open. The question is, it's going to be done carefully. I think it should be done with understanding all things weighed and caretaking, I don't have an answer.
I may have one.
Okay.
Based on the trend that we're seeing about getting the vaccines up, with President Biden and looking at May 1st, I'm not saying that schools are going to reopen right away, but I think we can project that by the fall of 2021, I think things will be back to normal. So that's all I'm going to say to that. So parents, just find a way to entertain your children. Trust me, and the vaccines will come out, hopefully for them. Children can be carriers, so again, you want to protect yourself as the adult. So keep pushing it and encourage, your children to follow the 3 W's, wash your hands, wear your mask, and watch your distance. So important to maintain the spread, to reduce the spread of COVID-19. So we'll look towards the fall for schools. I'm just saying, that's what I'm doing personally.
and if I may add just one, children in units are included. We now know that pregnant women, at least a pregnant woman who had a baby last week, I believe, that the antibodies were found in the baby, So and again, there's a clinical trial that Pfizer is running right now. Pregnant women who got the vaccine, efficacy is being tested. In fact, there is no CDC recommendation against not getting the vaccine in pregnant women. Discuss with your PCP, primary care provider. But yeah, that's also a way of protecting kids.
Dr. Nombaja, do you have anything to add to that conversation?
Well, I think that it's well said. The assumptions that Dr. Chodende made they sound correct. I think once we get to a sufficient number of people vaccinated, where the risk of severe disease is lowered tremendously, I think it's very unlikely that there's no reason to keep kids at home. It's also important to point out that the disease, for reasons that are still not well understood, is is unlikely to be severe in children. They just don't get very sick. 1 or 2 will have one unusual outcome, but that can be expected for almost any disease. So we really don't know why, but they just don't get very sick. So the risk actually is children passing it on to their parents and children passing it on to their teachers that people have been concerned about. But risk among children, they get a cold and stay home for a day and then come back the next day. For most children, it's like that. So, that's not my field, but I'm just being reasonable here and saying once a lot of people in the country get vaccinated, I think, please send them back to school. They need each other.
Thank you for your different perspectives. So now we're going to be touching on COVID survivors perspective. We have Mr. Motolani Agombiare, who's on the panel today. He will speak more about his personal experience with having COVID.
Thank you so much. I definitely want to say I appreciate everything that is being done. I myself was one of those people who didn't have as much information, so kind of went off of fear in regards to things. So this is an amazing thing. This is truly a blessing. I will say that in the initial craziness of COVID when it first kind of really began, when it first kind of hit last year, I was considered an essential worker. So I was lucky enough to still have employment and still go into the office every so often, not really much in the field. But I kind of phased back into really just being at home and trying to be as cautious as I possibly could. Washed my hands, didn't go out, ordered everything online, and it still managed to make its way into our home. It actually started with my daughter, who basically got sick. She was only sick for a day, and then it made its way through the household to my other children. The missus, she got sick, and just seeing how it kind of interacted with everyone, it was different. But I basically got the brunt of it. It kind of started, well, actually it started mid-March for me last year. And it pretty much went from mid-March until April when it really got bad. And then even after that, many months after that, I still, was dealing with certain aspects of it. So with me, it started off with basically a week, not really feeling well, just fatigue, pretty much all the symptoms that you would get with a common cold. It then went from that to a fever that just wouldn't go, me not being able to taste anything, like nothing whatsoever. Me always feeling like I'm thirsty, hot 1 minute, cold the next. And it was the symptoms just kind of every week seemed to get worse. 3 weeks in to me being sick, I had called my physician. They basically said, hey, we're not sure what you're dealing with. At least go and get tested. That's the best thing that you can possibly do. So I went to my local emergency room to see if I can get tested. And they basically did everything they could except for test, because they basically said I didn't meet the requirements or the criteria to be tested because they just didn't have enough tests. And me being who I am, I asked the question, what exactly is the criteria? And the medical professional leveled with me and said, you have to be at the point of being admitted before we would test you. So she said, in my personal opinion, more than likely you have it. So I just kind of went home, took that, with a grain of salt. My doctor basically said, hey, well, we can try to mitigate it. You don't know if you have it if you haven't been tested. So you could just be sick. It could be anything. Let's just wait and see. Another week went by, just really seemed to get worse. Went to a right time, which is like the emergency rooms, I guess, outside of the hospitals, and tried to get tested there, thinking maybe it's because the hospitals are so busy. That's the case. And they said the exact same thing, literally word for word. We can't test you. You don't meet the criteria. We don't have enough tests. And they said the same thing of you have to be almost to the point of being admitted for us to be able to test you. So basically, I pretty much was just taking as much as I possibly could to mitigate whatever I was feeling from, all the different types of general over-the-counter medications that you can get, hoping that it would basically go away. So this is now almost a month and 2 weeks. I've been sick, bedridden, barely eating anything. Shout out to my aunt, Auntie Jumake, who is a blessing, who literally came and used the power of the auntie to make me eat something and said, you have to eat. she came in regularly to make sure I was good, to take care of the family, just to check up on me and make sure that, you know, I'm still here. So it's about a month and 2 weeks in, the coughing started. I didn't have coughing at first, but then all of a sudden, really bad coughing started to the point where I was coughing up blood. So at that point, I said, you know what? I'm going to the emergency room. They're going to test me. They're going to do whatever they have to do. This is not going to happen. And at that point, when I spoke to the receptionist, I told them, hey, I'm not taking no for an answer. You're going to test me because this is what's happening. And she said yes. So she basically took me back. They did what they had to do. And the doctor didn't even come back into the room, literally stood at the door and said, yeah, you have COVID. We're going to go ahead and admit you. And it's a good thing you came in when you did, because you have a pulmonary embolism and there's a lot of blood in your lungs, or basically in your chest and whatnot, that you could have had a stroke. So it's really good that you came in when you did. And I say it's God. It's not luck, it's God. So they treated me, took care of me. I am truly grateful for the medical professions. Every single one of the doctors on the panel that are basically, you know, putting their life on the line to take care of people, me included, being experienced with, you know, having to have a doctor come in and go from room to room and seeing the fatigue on their face and still treating me like a human being and making sure I was taken care of was the biggest blessing. I even had a point where I was able to ask a lot of questions in regards to the type of care I was getting. And basically kind of getting an idea in regards to the medications that were being provided to me. And some of them I didn't agree with because I didn't know any information with, and they were okay, and they explained what they could to me, and was able to kind of really nurse me back to health. And it's one of those things where I was a big advocate for, you know, this can't happen to me. You know, if a vaccine comes out for this, I'm not going to get it. I'm not really a flu shot type of person. But just after experiencing it, even though I was pretty much at home for a month and a half before I got it, really made me feel like, hey, it can come from anywhere. It's one of those situations where you definitely want to make sure that you're covered and protected. So I'm definitely going to be getting the vaccine. But basically almost a good 2 months after that, I was finally, a week after, a week and a half in the hospital, I was released. I've had to take blood thinners. I just recently stopped taking the blood thinners as of January this year. So multiple different medications I've had to take over the time. I wasn't actually able to taste anything until almost October, actually. So it was months after the initial situation happened, my taste began to come back. So there's still effects. I still feel like I can't really take a deep breath, and there's certain things that I'm working on in regards to that with my doctor. So there's still lingering effects to it. So, and I understand it affects everyone differently. But just like, you know, the doctors on the panels have said in regards to the vaccine, I was right there with the fears. I definitely say it's going to be more beneficial to get that than to possibly get the virus, or to say, I'll wait and see. It's definitely not worth it. It's definitely not worth it. But I'm blessed to have the opportunity to speak in regards to my experience after it, versus having someone speak on my behalf because I'm not here. So, just the experience really opened my eyes, and I am truly grateful and thankful for it.
Wow, thank you so much for sharing your story and being so candid. We really appreciate you. And most importantly, we're so thankful to God that you are here. And as you said, you're the one sharing your story and not someone else sharing on your behalf. So thank God, and thank you for being so candid and transparent and sharing. Thank you. For those who may not know what a pulmonary embolism is, it is a blood clot in the lungs, simply put, but it can lead to all kinds of issues, and it can be deadly. So again, the fact that Mr. Agumbiade is here, we are so thankful to God for that. It's such an amazing testimony. And that brings us into our second Q&A session. In this session, we're going to be talking a lot more about the virus itself, the disease, the symptoms, and how it presents in people. So a lot of our questions are going to be centered around that. Again, just a reminder to everyone, please go ahead and drop your questions in the chat. We'll do our very best to get to every one of them, or at least try to answer your question type with the questions that we have that were already pre-submitted. So please go ahead and do that. And so I'll hand it over to Tani. Go ahead.
Thank you so much. So that was such a compelling story, Mr. Gumbiade. Thank you so much for sharing that with us. I personally have known people who've gone through it, and I tell you, different stories, different cases, different symptoms, and different consequences or results to having the virus. I know you spoke about how long it took you to have those symptoms. Basically, some are still lingering. You started out with the effects of not being able to smell or to taste. You had it for about a month and 2 weeks, and then the cough started. So the cough wasn't initial. It started after about a month into your infection, and then you had blood clots in your lungs, and then you have lingering effects of not being able to breathe. Are those still the lingering effects you have, the symptoms that you have, or do you have more that you can share with us?
So pretty much those were the symptoms that I had. The craziest thing in regards to the coughing came later on. The not being able to taste actually came almost 3 weeks into it. And just to kind of give a real quick breakdown, the way it passed through my family, everyone had a different thing. Like my daughter just had a fever. The missus, she basically had high blood pressure and a fever. And she got tested and she found out she had it. My daughter, she basically wasn't able to taste at first, then had a really bad cough, which then tapered off into her having a fever and then having all the symptoms of a common cold. Me basically starting off with all the symptoms of a common cold, and then it basically ramps up to getting worse than that. In regards to like breathing, it's a lot better now for me now. And I feel like my body's getting back to the way it was before. But it's still one of those situations where I can take a deep breath and then I start coughing, which never has been the case for me before. So, you know, how long it's going to last in regards to it, my doctor says, you know, your lungs are getting back to what they were, but it was really bad at one point. And how long it was bad like that, they don't really know, because, you know, I finally came in at the point, I guess, of it being at the max.
So what message do you have to a young adult who says, listen, I'm young, I'm at low risk of contracting the virus, and possibly nothing will happen to me? Do you have a message for someone who's young and believes that they can't or they won't go through the same effects or similar effects that you did?
I will say no one is superhuman. I had the mentality that, oh, I'm in the house, I have hand sanitizer at every location in the home, I have my kids washing their hands on a regular basis. There's only so much that you can control and you can do. You only have control over yourself, let alone someone else. And that virus is so small that you can't see it. It can be anywhere. So the best thing that you can possibly do is take more of a proactive step versus a reactive. And the vaccine, once it's available for, you know, younger people and including children, me, myself, I'm 37. So I would say anyone in my age group should have already gone and, you know, tried to get that, you know, get it taken care of. Just don't take the chance. It's not worth it. You shouldn't have to experience it before you get the knowledge of the aftermath. So it's not worth it.
Thank you for your message.
Thank you so much. And I really loved what you said, being proactive versus being reactive. That is really, really, really important. My next question is for Dr. Agini. I know you already touched on this in your presentation, and, you know, Mr. Gumbiade also shared some of his symptoms, but could you just with this disease, a lot of things are constantly evolving, and so there are lists of symptoms, and we just touched on the fact that it may not be the same for each individual. Based on updates, what current symptoms are suggestive of COVID, and how does one, or is there anything that differentiates it from symptoms of the flu or the cold versus COVID? Is there anything that differentiates the three?
Okay, so COVID symptoms, there are no what we call pathognomonic, which means there's nothing that is specific, so to say, as a symptom for COVID disease, 19 disease. Could be anything, and just like our brother just shared, it could just be a clot in the lung, a stroke, it could be suddenly blowing up, and then we realize that the kidneys are not working well, and then we find out that there's a clot in the renal artery, and that's the blood vessel that supplies the kidney. So actually, there is nothing that is very specific. I mean, he has described some of the more common symptoms, the fever, the cough, sometimes chills, muscle aches, loss of taste, and all that. But there is nothing. The only way to know if someone has COVID infection in the presence of these symptoms is to test. That's the only way to know. I mean, we can suspect it, but we just got to test to be able to say that this is what it is. Yeah.
No, thank you for that. And so everyone's heard it. It's just go ahead and test. There's no delineating symptom. They're all sort of similar in their presentation and how a patient will have symptoms. So if you suspect, if you're sick, just go ahead and get tested. I've heard of situations, unfortunately, back home in Nigeria, where I'm from, where people say, oh, I just have malaria. Or some people here that say, oh, it's just the flu. But no one knows. So it's better to get tested so that you can then start to get the treatments that you need or start mitigation strategies for getting better. So thank you for sharing that, Dr. Agini. Tammy?
Nurse Bumi, this question is for you. I know you work in the ICU. You've been a traveling nurse. Can you share some of your experiences working with COVID positive patients, how they fared in the ICU and how they progressed?
So by the time the patient comes to the ICU, unfortunately, the patient is not doing very well. I've had patients that, they come in talking, we chat, we talk. And as the doctors have said, they go into what we call a multi-organ system failure, which is when the kidneys begin to fail. They have blood clots in their lungs, and things get worse in the sense that we do everything we can to keep them as much as we can, but in the long run, the patients die. At the same time, I have a patient that I often talk about on Facebook. His name is Chris Gaza. We call him our miracle story, meaning that this patient went through this process, and now he went back to work on Friday. Yeah. So once again, I am going to take it back to that. I am imploring people. I am begging you, because I've been there. It's a horrible, horrible disease. We should all please get vaccinated, please, because once you are in the ICU, unfortunately, we don't have that many positive cases of patients getting better. I have worked in like 30-bed ICUs, and let's say we have 1 or 2 patients go home. 1 or 2 patients get better. So once again, please get vaccinated. Please do. Thank you.
So Nurse Bumi is imploring you out there,
I
please
am.
get
I am.
vaccinated.
I'm begging.
I cannot begin to imagine the experiences that you've had over the past year, especially with the deaths
a lot of deaths
related to COVID.
Yeah.
So thank you for sharing that.
Absolutely.
Dr. Chodende, this question is for you. So I know Nurse Bumi just touched on the very severe cases that we see in the ICU, but there are some patients or some people who have more so mild to moderate disease. And we know that there are some COVID treatments that are being spoken about in the news and media regarding mild to moderate COVID disease. So can you share information briefly on that, and how can they get those treatments if they find themselves in that unfortunate situation?
Thank you very much. In fact, this is very important because we've talked about vaccines, and there was something that Dr. Ageni said, right? He talked about when you do get the COVID-19, when you test positive, then you isolate yourself. However, for specific individuals that are considered high risk, so I'm going to put some information in the chat. It's very important because high risk affects almost everybody, minority groups. So for instance, if you're over 65 and you have chronic kidney disease, you've got diabetes, you've got hypertension, you have an immunosuppressive disease, you've got cancer, you're 55 and above, and you have COPD, which is a chronic obstructive pulmonary disease, and you have a cardiovascular disease. And then even children between the ages of 12 and 17, especially our dear kids that have sickle cell disease. Again, they have asthma, they have immunosuppressive diseases, they are morbidly obese. They've got congenital heart failure, heart disease. I'm going to put some information in the chat box. Please, I implore everybody who is high risk, individuals, and if they do get positive, so let's say you're not feeling well, you go get tested, and you go to the pharmacy, and or you go to a test site, and they tell you you're positive. You have immediately 3 to 10 days to get this monoclonal antibodies. Now, ex-President Trump had gotten this monoclonal antibodies, and everybody was like, hey, what is this magic drug, that cured the president? He went in, he was positive, he went into the hospital, came back, and he's back to work. That is what we're talking about. So the US federal government has invested a lot of money, right? And they're making available the monoclonal antibodies. There are a lot of doses out there. However, our people do not know about it. And what happens is when they're positive, they're told, oh, you have to go quarantine. Well, now we know you have to isolate. However, you can also get treated if you are high risk. And so it's so important to spread the word. Just tell everybody, please, this famous drug, okay, it's just monoclonal antibodies. What happens is when you get positive, you get this monoclonal antibodies, you go to an infusion site, you sit there for an hour, they will infuse the drug in your body. And then you sit there for another 1 hour because you're going to be observed by a nurse or a healthcare professional to make sure that everything is good. There hasn't been really any side effects that have come out. The only ones that we've heard about is, oh, I do get nauseated. I feel like vomiting, I feel like throwing up. And then they'll give you a medication for that. But then it can potentially save your life. It has been proven to keep you out of the hospital. And again, you don't want to go to the hospital. Let's leave the hospital for the really, really sick people that need to get treatment. So again, this is for high-risk individuals who have tested positive. They have mild to moderate COVID-19 symptoms, and all it is you got 3 to 10 days to get this monoclonals into your body, okay? And then it can save your life. And so we want everybody to please just tell people, don't you got positive. It's stigma. Oh, I have COVID-19. Something happened to me. The devil has done something to me. No. It means let's take action. Let's go there. Let's get the medicine we need because we want to live, and then want to tell people about our stories. Just testify that this happened and I got this this drug and I'm well again. So that, so again, to be clear, you have the vaccine that prevents you from getting the COVID, okay? Then you have options. You get the COVID-19 virus. What do? You can isolate. You're healthy. You're fine. But if you are high risk and you are 55 and above, you have certain diseases, severe diseases. You are 65 and above, you have severe diseases. You are a child between the ages of 12 to 17. Please, please, please seek treatment immediately. Monoclonal antibodies. I will put my information out there. If you need anything, you let me know, and I will provide you anything that you need to get you better, or to give you the information that you need to get, whoever you want to get better. Okay.
Thank you so much for that, Dr. Chodende. So I think, there are a lot of things that you said that I just wanted to just, touch on a bit more. High risk. It is important, and I think this underscores the importance of knowing your own health risks, making sure that you're keeping up with your appointments so you know what diseases that you have that actually put you in a high risk category. I know there are a lot of people who are very afraid to go to the doctors, get their blood tests done regularly. This underscores the importance of that, because how do you even know if you're high risk if you don't know your own health issues? I think that's number one. Number two, it also underscores the importance of ensuring that you're not just playing this off, especially if you're high risk, but that you're going in a timely manner to get help. So Dr. Chodende mentioned monoclonal antibodies, you only have a short window of 3 to 10 days. So you can't just sit at home and, think, again, there are some people in which isolation is what they need to do. And she has said those are the healthy folks, but those who are high risk, it really underscores that importance of ensuring that you're getting getting care in a timely manner. And then the third thing is the importance of being your own health advocate.
Yeah.
When you go to the hospitals or go to a clinic and say, I think I have COVID, or I'm having symptoms that are suggestive of COVID, it's important, if they tell you they can't test, push for it. If they tell you that they don't have, treatments, ask for it. Continue to ask for it, continue to push for it. If you have someone who's a healthcare professional in your family, have them advocate for you, because, I think they bank on the fact that a lot of minorities don't have the information readily available. So it's important that we equip ourselves with the information and we're our own health advocates, or have someone else advocate for you. Minority groups, unfortunately, have a lot of underlying conditions. It just, this COVID was it revealed a lot of things, right, with the health disparities in our country, and showing how minority groups have been disproportionately affected. So really, please, again, know your health status, know your risks, advocate for yourself, learn more about this monoclonal antibody. Dr. Chodende has already said you could reach out to her, and we'll have contact information for all our panelists at the end of this as well. So thank you so much for sharing that.
You're
Tammy?
welcome. Oh, one more thing. It is free. I need to say that. Just like the vaccines are free, it is free. The government is doing everything in their power to make sure they're distributed free of charge. Of course, if there are any extra costs, like it depends where you go get your vaccine, they say, you have to show, for whatever administrative related cost, that's different, but it is free. So now you heard, oh, I'm done. Please spread the word. Tell everybody there's a cure. Well, it saves lives. That's it.
I got you, Dr. Chodende. So basically, for those in the United States, I will have to stress this. The vaccines are free. The treatment is free. The monoclonal antibodies are free. For those in the US, I know this is going to be geared to several countries throughout the world, but in the US, the vaccines are free and the treatment that we have right now is free. So now, speaking of treatment, so COVID infection in the US, we have vaccines to kind of help you, prevent an infection, to help mitigate symptoms if you do get infected. We have the treatment. We have the monoclonal antibodies free in the US, right? All right. So now this brings me to home remedies, AKA what's up remedies, remedies that are passed down from person to person. So this question is for you, Dr. Agini. You have a patient who comes in. Oh, Dr. Agini, my favorite doctor. Listen, I have COVID. I know I have COVID, right? I have this fever. I have this cold. I have cold symptoms. I can't taste anything. I got tested and it is positive. You've told me to self-isolate, right? Okay. But while I'm self-isolating at home, what can I do? Okay, so I heard about hot fluids, herbs, laying on my stomach, incentive spirometer. I even bought a pulse ox from Amazon. So please tell me, what are your suggestions with home remedies?
Okay, I don't think a pulse ox is a bad idea, by the way. So get a pulse ox if you want, but problem is, I hope you understand how to use a pulse ox and to interpret whatever the pulse ox says. I think the most important thing here is, one, recognize that this disease can evolve, and be careful, watchful, so that if there are new symptoms, if there are things that are popping up that are unusual, getting increasingly more short of breath, and sick, you need to come back to the hospital and see the doctor. And number two is, I think we've belabored this part, the fact that for mild and moderate symptoms, don't require hospitalization, and for people who are high risk, that there is available treatment, one-time treatment that they can get with these monoclonal antibodies. Now, for the other home remedies, there's no evidence that any of these things work, right? And I just want people to also be very careful so you don't hurt yourself. Don't go drinking hot water, and burn your, cause burn injury or something. Some people say vitamin D works. I have nothing against vitamin D, but don't poison yourself with vitamin D or get hypercalcemia or something, vitamin C, all kinds of that type of things. There's different flavors, but people need to be careful. There are specific things that I need to line proning and all that stuff. I don't know that it is helpful for someone who is at home, but please, let's not abuse medications or drugs without clear understanding of what we're doing. If you're in doubt, talk to your physician or doctor, whoever that individual is, primary care provider, and get clarifications before you do something that hurts you.
Thank you for expanding on that, Dr. Agini. Nurse Bumi, do you have anything to add to suggestions of home remedies?
Yeah, sorry, I had to on mute myself. So I actually, when patients are in the hospital and they are not as sick, we actually tell them to prone, meaning that they lie on their belly, and that has actually worked. We've also have them use the in incentive spirometer. For some patients, it has worked, but like the doctor said, if you get worse, please definitely go see your doctor. The best thing, is still to wear your mask, wash your hands. Hand hygiene is key. And please, when people wear gloves, take it off. People just carry dirt from one place to the other. The best thing is to wash your hands and practice hand hygiene. And then, also, if things get worse, go see your doctor.
So a common theme, thank you so much, Nurse Bumi. A common theme I'm hearing is that follow up with your primary care provider. If you don't have one, please reach out to us. Our contact information is going to be listed, and we will suggest places for those in the US.
Mhm.
Once you reach out to us, we can help suggest with that. So follow up with your primary care provider. And secondly, I hear about the 3 W's. I'm hearing about washing your hands, wearing your mask, and what was the W about maintaining your distance? Watch your distance. Yes, watch
Yeah.
your distance.
What's your
So
distance?
6 feet when you're out with your mask on. So
Yeah, sorry. I wanted to say something that I forgot to say. People, please don't be anxious, okay? I say this from a point of seeing a patient that was walking and talking go bad. And I've had multiple patients. COVID is a disease that greatly affects the psychological, okay? So when people feel anxious, I feel like they will die. Unfortunately, these patients have died. The key thing is please stay positive. Stay positive, do your part, and don't keep thinking, I'm going to die. No, please stay positive. It is really key, please. Thank you.
thank you. Thank you for adding that. So
Absolutely.
anxiety has been
Yes,
shown
plays a key role. Yes,
to
yes.
to worsen one's condition. So
Yes.
as you've heard Nurse Bumi say, please maintain positivity, be positive. If you have a local church, organization, or social
Absolutely.
club, please
Mhm.
join. I know we're in the age of being virtual, socially distant per se, but please get in touch with someone. We will also list some resources for mental health providers as well for you. So in terms of home remedies, I guess what I'm hearing from Dr. Agini and from Nurse Bumi is that first, just seek professional help with your primary care provider. Know that your condition, know that you need medical care rather than home remedies, which have not been evidence-based. So there's no study out there that says a certain kind of herb is going to cure you. So just be aware of that. All right. So Dr. Fumi, I will hand this over to you.
Thank you so much. Dr. Agini, this question's for you, and this is one of our audience questions. So this individual wants to know, if they get the first shot of either the Pfizer or Moderna vaccine, do they have to maintain, does their second shot have to be the same manufacturer, or could they get Moderna as the first shot and then maybe Pfizer as the second shot, or vice versa?
So the recommendation in the United States, CDC again, is that you get the same vaccine. So if you had Moderna, you should get Moderna second shot. If you had Pfizer, you should get Pfizer second shot. If you had Johnson, it's 1 dose, Yeah, so that's the recommendation. And there is no, I think in the UK, there was some time when they started trying to do something, try to shop around. If you got this and you can get that, but that's not recommended in this country. And you shouldn't do it.
Okay, thank you. Short and sweet and to the point. Don't do it. Stick with the same manufacturer that you started with. Thank you, Dr. Agini. Tammy, over to you.
Thank you. So this question is going to go to Dr. Chodende. Hand washing. So would you prioritize hand washing over hand sanitizers? When should one wash their hands, and when should they use the hand sanitizers? If you could please just elaborate on that, the difference and the importance of them.
Okay, very briefly, very elementary. Hand washing is key. Water and soap. You don't even have to use an antibacterial soap. You can use any soap. But that is the fundamental way to stay and have clean hands. The hand sanitizer, recommending if, you're outside, you don't have time to wash your hands. Yeah, you can do that. But the problem is if you put it in your mouth, you're poisoning yourself. Or you're endangering, you can get something from that. The key is just hand wash is better than hand sanitizer any day. And so do not supplement hand sanitizer. Don't interchange, and say, oh, okay, I'm going to, instead of me washing my hand, let me just hand sanitize. No. You're putting, you're putting some chemicals on your body. alcohol based. So please, please, please just hand wash as much as possible and keep your hands away from your face, because that's how things are spreading. You know, you contact, you hold things and you catch the virus, you take someone's boogers and stuff and you put it all over your face. You don't even know. Don't touch your eye. Just keep away from your face. And that's something that we as healthcare professionals have tried to push out as far as maintaining, reducing the risk. So hand wash, please, as often as you can. That's it.
All right, thank you. Really appreciate that. Dr. Chodende, this is for you, and anyone else can feel free to chime in as well. You know, we touched on the fact that COVID has disproportionately affected minority communities, and not even just the disease itself, but even vaccine distribution and treatment, etc. So why do you think that is? And from a public health standpoint, what efforts are underway to overcome that?
Okay, so again, it has to do a lot with just how we're organized in a community. You know, we have cultures, we're organized in what, based on culture, ethnicity, racial, race, age. We're also organized, based on our gender preference, our sexual orientation. We're organized also, by where we live, our zip code. Are we, the homeless? You have people who are disabled. There's been so many inequities that we are seeing now for the first time. Well, it's becoming more prominent now because of COVID-19, which is actually what we need to focus on, because America, we're full with so many people. We come from different backgrounds, but this is what makes America who we are today. And of course, with that being said, we have a lot of our cultural biases. We have a lot of things we've picked up along the way. Oh, I'm not going to go to the doctors because when you only go there when there's something serious. But again, you have to do that checkup for yourself. It's really advocating for yourself, and just pushing for positive intent. And so what's going on right now is the United States government is really making this a priority. This is the biggest thing right now, because this is who we are. We're human beings. And the White House has created a task force. It's called the White House COVID-19 Health Equity Task Force. And it's been headed by Dr. Mrna Smith. And she and her team, they have about 12 people that have been identified to work in key areas. And you can tune into the White House live updates, anytime, just to get more, just to understand and kind of learn how the White House is really trying to, I shouldn't say White House, the administration is really trying to promote equity among everybody. And so, that is one thing that the federal government is doing to push. However, we can't just expect it only from the top. We have a duty, because we look at ourselves every day in the mirror, to really say, hey, you know what is it in our communities? What are we lacking? What are the disparities? How can we come together as a community to raise it, to really bring, so like, for instance, what we're going through right now, this whole platform, this is awesome. And all of you that are tuning in, thank you for doing this. But as you're hearing this, feel free to disseminate the information. YouTube, just send it to as many people as possible, anywhere in the world, because this is only how we can get to the level where everybody is getting the same treatment, the same medications, the same healthcare system, the same opportunities, cuts across the board. And so I hope I've spoken enough about that, but this is really a priority. And this is a chance for all of us to come together, brainstorm, and really see how we can make this country that we all came to beneficial for us who are here in the diaspora, and for everyone also who's back home, because they're looking at us to learn. It's not only sending money, it's also what information do you have? Because media shows a lot of information that is not really correct. We've seen all kinds, we're on WhatsApp groups, we've seen all kinds of myths of all this stuff. Oh, do this, you do this for COVID. No. So let's provide concrete information, correct information, truthful information, clear and succinct, and let us help each other get better. Thank you.
Thank you so much. That was really great. And sort of, you kind of took us to a final question, because there are a few things you touched on, which is having correct information, knowing where to get it. So can you share very briefly, where can we get this information? You know, a lot of this is rapidly changing. So how can we sort of stay abreast of all of the ever-changing information? If you can also touch on where people can find out, if they need some type of insurance to be able to get it, especially for those people who may have undocumented relatives, who are uninsured and just are afraid that if they go and try to get help, get information, that they, you know, there might be repercussions for that. If you could just summarize that, and anyone else other than Dr. Chodende, please feel free to chime in, but this will be our final question. So thank you for that.
Thank you. And I think, yeah, it definitely implores everybody to come in, because, you know, I don't have the answer to be all, but I'll tell you this, I will Google, but when I Google, I'm going to look at anything that is US government, okay? CDC. That is your best bet. CDC has so much information. ASPR, I'm going to store these mnemonics. The White House, even the HHS.gov, YouTube has a lot of information, but back it up with government, public health, government officials, back it up with people in academia, in the scientific world. And I know, you know, there's skeptics about, oh, you know, it's not spiritual enough, but it is. I mean, what else? I'm going to put some information in the chat box, okay? And feel free to use that. Also, your counties, the state government websites that have public health information on there, treatments, how to, even your pharmacist, when you go to the pharmacy and you're looking, you know, you may not have insurance. They are websites that cater to this. You know, you have the CMS website as well, the Centers for Medicaid, Medicare Services. Again, government engines, search engines will help you get information that you need. And just speak up. You know, if you don't say anything, closed mouths don't get fed. So if you need something, just ask somebody. Somebody will know somebody that will know somebody that will know somebody. Even church, you know, as we are here, please just, you know, feel free to contact us and we'll be able to help you with that information. I hope I've been able to, and everyone, please chime in, because there are lots of sources of information, and I mean, I go with whatever says .gov. Anything .gov, I'm good.
Thank you so much. And that was great. I think you provided a really great list. We also are going to be providing you with resources at the end of this. So if you didn't catch everything that was said in terms of where to find information, we'll provide you with a resource list at the end of this. So thank you. Tammy, over to you.
Thank you so much, Dr. Flumi. And this was such an informative session. I believe it was valuable. I believe everyone that's listening has learned and taken a lot of nuggets, golden nuggets from this discussion. So on behalf of my co-host and I would say that we really enjoyed facilitating this discussion, this meaningful conversation. I would like to thank our panelists. Thank you so much for taking your dear time out on a nice Saturday, beautiful Saturday morning to come and talk to us about COVID vaccinations, the myths, the treatments, mitigation strategies. I'd like to thank Dr. Chodende, Nurse Fumi, Dr. Agini, Mr. Agumbiade, Dr. Onabajo. Thank you so much for speaking. I will also like to thank JesusHouseDC. Without this organization, without this church, we would not have had this wonderful opportunity to spread the word. So to the leadership of Jesus House, the pastor, Pastor Gandhi Olaye, we thank you so much for allowing us to speak out on this. I'll also like to thank the Ignite DC and Rapha Health Ministry within the ministry for putting this together. I'd like to thank all the people behind the scenes that you all out there cannot see. They've been working really hard to make this happen. And finally, I'd like to thank our audience. Thank you for tuning in. And I hope you were blessed by this information. I hope you would take this information and use it I hope you get your vaccine when it's time for it. So over to you, Dr. Fumi.
Thank you. Thank you again, everyone. We really appreciate and value the time and the knowledge that you've all shared. So thank you. I believe the team will be showing a PowerPoint slide shortly with all of the information and the resources that we talked about and contact information of our panelists should you need to get in touch with them. I do want to thank a very key person to this event and the ministries involved, and that's Pastor Olumide. Thank you so much for your guidance, sir. We really appreciate it. We just honor you and we thank you. Thank you for helping us make all of this possible. So thank you. So as I said, a PowerPoint slide will be going up shortly with contact information of all our panelists as well as resources. And you might also see a slideshow that just shows people who have been vaccinated and wanted to share that information. Just something for you to take a look at, for those who have had fears. These are people in the community in our church that you may know. So, they took the vaccine, they're fine. We didn't have a third arm growing. There were no mutations. They're all fine and healthy. So just wanted to share that with you. Again, thank you all so much for your time and your patience. And we hope you learned a thing or two. And we hope that you enjoy the rest of your weekend. Take care and have a blessed day. Bye.